Shannon Gibson's speech 3, The Persuasive, in front of a live audience of 1, 2, 3, 4, 5, 6, 7, and 8 people with our cards, 3 note cards. And now for my cameraman. Alright everyone, so we have a problem. Many Americans are going without much needed health and medical insurance. In fact, according to the Henry J. Kaiser Family Foundation, 28.5 million Americans are going without any access to affordable health insurance. Now, we as Americans, we not only have a need, but we have a right to a universally free health insurance, regardless of income. Speaking of income, let's meet Marco. There are several of us like Marco. He's in his 30s. He's married with 3 children. He's working, attending community college, and unable to afford health insurance. His job isn't required to provide him with health insurance because he only works 28 hours a week. Marco's wife, her job is not offering spousal insurance at this time, and together they're only making $42,000 a year, which is barely enough to make it, but our government says that they're making too much money to be eligible for Medicaid or Obamacare. If you're looking at buying a plan from Obamacare, that's going to cost you $350 a month. That's about a car payment. Now, Marco is sadly one example out of millions of people that are going without health insurance simply because he can't afford it. Today I'd like to discuss with you the need of a universally free health care, how it would benefit America, and how it actually works in our economy. First, let's talk about the need of a universally free health care. The American Diabetes Association says that for one person, it would cost about $10,000 annually for their treatment. The American Cancer Society says it would cost about between $15,000 to $50,000 annually for treatment for the uninsured. Now, these greedy treatment centers might say, well, it costs so much because we're saving lives. That might be true, I'll give them that, but what about something small like a broken leg? A broken leg could cost a person between $13,000 to $35,000 just to treat it. Now, what about preventative care measures that we can take? The Center for Disease Control says that we could save over 100,000 lives. Kind of jumped over ahead of myself. Preventive care measures such as exams, vaccinations, tests, those could cost a person thousands of dollars as well. And the Center for Disease Control says we can save over 100,000 lives if we just took those simple preventative care measures. Now, what about how our country is going to actually benefit from this? There are several ways that Americans can benefit from free health insurance, but I think one of the most impactful is going to be saving infants' lives. If everyone had free health insurance, we could save about 10,155 infants' lives a year. Now, what about how this free health insurance is and saving money? According to the Organization for Economic Development, each citizen would save $3,667 a year. If you pulled out your calculator, did a little math, that saves all of our citizens total $2 trillion a year to keep in your pockets. Now, with the benefits out of the way, or the needs, let's talk about the benefits. jumping ahead of myself there. Let's talk about how this is going to work for our economy. To understand how it's going to work for our economy, we have to first talk about the myths, the lies that are related with free universal health care. One of the myths is that it would cost taxpayers more money. This is just not true. Taxpayers are already paying $2.5 trillion a year, which is about 2.5 times what citizens of a country with free health insurance pay. So myth number 2, the Affordable Health Care Act and Medicaid expansion already took care of our problem. I've got 28.5 million people to say otherwise. And myth number 3. There'll be less people trying to be doctors and lawyers because they wouldn't get as high of a salary. Well, as a matter of fact, the countries with free health insurance offer a discount on their tuition, trying to save them hundreds of thousands of dollars in debt from going to school to become these doctors and nurses. All 3 of these myths are actually false. Now, the next question is, how would our country switch to a free healthcare system? Well, we could look at other countries, United Kingdom, France, Canada, and just to see their model and how their economy, how their government runs with a free health insurance. So to recap, we've talked about our problem, we've talked about the need of free health insurance, the benefits we can get from it in our country, and how to actually switch and how it work. Now, if you'd like to sign a petition with me, and you can visit moveon.org. I have petitions out on the table. Visit them and sign it. But I'd like to leave you with a quote from Winston Churchill that we all need to think of. He claims that healthy citizens are the best assets a country could have. All right, thank you for listening.